it's like so overwhelming. GLP-1 agonists are an extra way to close maybe 20 holes at a time, I found. I'm serious. Yeah, it's pretty cool. So this study from Dabara et al. Just came out last year. GLP-1 agonists therapy in people with obesity restored natural killer cell metabolism and effector function, they found. And this was measured by cytotoxicity and interferon B production. They found all these benefits, cytokines, storm kind of reductions as well. So that again can help people with mast cell and SIRS, I believe. And we have clients with mast cell and SIRS and high mold toxicity and layered with Lyme and co-infections, and they actually do feel better on it. And they only necessarily, usually don't consider the higher dose. They already have so many gut issues, they don't push it. So this group, Bendati et al., they have this wonderful graphic about the anti-inflammatory and the beneficial immunological properties of GLP-1 agonists. So profound. Look at this. GLP-1 expression, we already know, is multi-system, pleiotropic. Every system's affected. Improved cardiovascular function. We see lower CRP and even reduction in cardiovascular risk with ischemia. Brain, better kidney, better liver, better pancreas, better eye even function, better, of course, gut function. I'll go over some of those later, and endothelial function. Well, the immune system is a target for GLP-1. There's lymphocyte T and B memory cells improvement, macrophages, the natural killer cells, eosinophils, neutrophils are all, they have receptors apparently, and they're better. This is just a new study that came out, and this explains why they're actually very, very helpful. In vitro, they saw this in mice models, they saw it, and actually they're translating it now and seeing it in human clinical trials. There's a reduction in cytokine production. There's a reduction in pro-inflammatory T cells. There's a reduction in macrophage infiltration and an increase in regulatory T cells. Again, Treg cells, those are bomb. We just don't have enough of these. So their conclusion, GLP-1 agonists, they demonstrate and exert anti-inflammatory and immunological properties in different experimental models. I think it's pretty profound. And again, how do we grab some of these dosages? Well, I'm going to go through a couple case studies and case reports that are published, as well as ours. And the dose doesn't even really have to be that high, 1 milligram a week of semaglutide, or even 2 to 4 milligrams of tirzepatide. And if it's liraglutide, I think it was 3 milligrams, because the max is 6 milligrams. So what a microdose is like when we're talking about psilocybin or other psychoactive things, we're talking about 10% of a macro dose. So when we talk about the GLP-1s, 10% is pretty reasonable. There's some people that may even do it over a week. But if we add it up daily during a week, that's about the 1 milligram dose per week. Let's say they do it 5 days a week of 200 micrograms. So it's average like a 1 milligram dose per week. But 10% of the max dose, max is 2.4, or I've heard of, some outliers, 3 milligram, and I think some studies looked at that too. But that's 10% of, 2.4 or 3 milligrams. That's about 200 to 300 micrograms a week. And there are some in the patient advocacy groups, that's actually a dose that's been reported really helpful. And these are people even with massive mast cell issues and other things, and great benefits seen there. Now, to date, so if we're looking at how is the gut microbiome affected, I was hoping to find some good things, but since our last talk in 2022, we have hardly any new studies, even in animal models, and definitely not in humans. So to date, there's no studies really looking directly at effects of xanthine, which is the earlier Byetta, or semaglutide on the gut microbiome yet. And I personally suspect, through interactions and knowing our client microbiome studies, Why do certain people get nausea or, really severe constipation? It's not just the reduction in fiber in their diet, I don't think. Or why are they more at risk for pancreatitis? I think it's all related to their microbiome. Pancreatitis is related to alcohol and aldehydes made by Candida and putrefying bacteria like E. coli and Pseudomonas and others that pump out alcohol and aldehydes. And even though these people, some reports of pancreatitis, they're not drinking alcohol, and yet they get elevated amylases and elevated lipases. This is coming from the gut microbiome. They're TMAO generators from the putrefying bacteria, which we can see easily, right, on GI map, or we, not species-wise, we can see overgrowths on the organic acid test. And I think it's so great when people have more modulation, I would say maximizing their microbiome. Side effects to GLP-1s go way, way down. Not to push the dose or anything, but they just feel much better on it. Much less, no reports of nausea, constipation and gut issues and IBS. Some people get they get diarrhea with GLP-1s. That's reported with it, and they just don't have these anymore. So other diabetic medicines, metformin, and the other are GLP-1s. These are the animal studies. There's an increase in short chain fatty acids. Actually, this metformin is probably in humans as well. They see Akkermansia resurrect, and butyrate makers in the Firmicutes class resurrect. They see an improvement in proteobacteria. There's other changes, decreased TMAO. Glutide had a growth in Bacteroides and Akkermansia. That's awesome, because we know Akkermansia is linked to leanness. Increase in lean-related phenotypes. That means Bladia and Capricalis, and a decrease in the obese phenotypes, Rombosta, Ruminantoclostridium, and the Erysipelas one group. And glutide, an increase in Bacteroides as well. So we need Bacteroides. Again, they're eating our fiber-rich grains and beans. We don't want to lose them. And they are part of the lean phenotype of the microbiome. So TikTok is full of all these like memes and little videos now. It's so funny. Side effects of Ozempic are rife. And that's because, again, people who are dealing with troubles with getting lean mass and lowering body fat composition, it's because they already have like a poor gut microbiome, or they're having long haul and many co-infections as well. And that's all microbiome related. So how can we help, how can we help reduce a lot of that? Well, we got to look at some of the root issues. We know with GLP-1, it actually helps one root issue, which is long haul. We're seeing some, just remote, some random and remote case improvements of that. And I'm one, actually. I'm going to go over the case. But GLP-1s in a clinical trial, at least one that I came across, it improved COVID by 83%. They were 83% less likely to die in a meta-analysis of 9 studies. Huge. That's like a super huge improvement. And these authors, pulling the data, they thought to look at it because they knew GLP-1 agonists, they showed improvement of lung damage in animal models with GLP-1. So they were, projecting this into COVID-infected humans. And into the animal models for lung injury, GLP-1 helped mitigate pulmonary inflammation, it reduced cytokine storms, and it preserved lung function. If you hear the prior GLP-1 training I did, there is a Shanghai study, TA1, thymosin alpha-1, helped to improve cytokine storm, and it was shown at a high dose, 10 milligrams a day for 7 days or longer to endpoint death or getting better. It saved 3 times the amount of death mortality with COVID and respiratory failure patients in hospital. So can you imagine when we layer different peptides? This is why in the peptide pearls, I go over like how to, it may even help dose reduce and save resources for buying these peptides or getting prescriptions for them, because by layering them, we're seeing, you can get the synergism of the benefits of all of them and using less dose. So if it's whether it's NK killer cells or improving lung function or preventing mortality and morbidity from long haul or the actual COVID. I think that's something to really, really consider. And other studies have shown, they want to look at gut composition, because in other studies, gut composition affected endotoxemia, which is part of the COVID death rate, and it's quite pronounced. And GLP-1s improve endotoxemia. In animal models, it helped the enrichment of Bacteroides, the studies I showed earlier, and improve LPS and endotoxemia. So their conclusion was that GLP-1 agonists can prevent or reduce sustained hyperglycemia. Additionally, that might be an extra protection for COVID. And here's the improvements in the 9 different studies across the world. So this was like multinational, multi-center meta-analysis. And again, why is this so powerful? Because in the GI tract in animal studies, it increases bifido. I'm going to go over 3 reports of those, and particularly bifido longum. Where can we get bifido longum? Well, besides just using GLP-1, we could take it.